Lots of dentists use traditional braces to straighten your smile, but Dr. Kami Haas says braces have come a long way in the last few years, and now there are lots of options. Joining him this morning is two of his patients, Claudia and Josh. Good morning, everybody. Thanks for being here.
Good morning. Thanks for having us.
You know, when you think of braces, you think, you always have to go to the orthodontist. I remember, when I was a kid, my friends were going, it seemed like every couple of weeks to get them adjusted, and they were on for 3 or 4 years. That's changed.
That's right. Those unforgettable appointments.
Yeah.
Well, when we think of braces, actually there are two types to braces. There are two types, parts to the braces. There's the brackets that we put on the teeth as a handle to move the teeth, and then there's the wire that we use to actually engage those brackets and move the teeth with them. There are two types of braces. As you said, there are traditional braces, and there's the self-ligating braces that our two patients, Josh and Claudia, are wearing.
And these are some of the traditional braces.
That's right.
That people wear, and there's a lot of metal there, and this requires constant adjustment by the orthodontist.
That's right. So the main difference is that these traditional braces, they actually require either metal ties or elastic ties to hold the main arch wire into the brackets. And the metal ties are very uncomfortable. They can poke you, and they create a lot of friction. And the elastic ties can stain over time. They make the teeth look really dirty, and they also they need to be changed all the time. So as you mentioned, you got to go to the orthodontist once every couple of weeks or every month. So it increases the length of treatment time, and it increases the frequency of the appointments.
And with these braces, there's two different types of braces that they're wearing.
That's right.
But it really lessens that process for them. The length that they're on, and the time that they have to spend in your office, right?
Well, actually, the difference is night and day, but those are the two most important probably differences. The self-ligating or self-adjusting braces, until just recently, they were only available in metal, but they finally came out with a clear version, which is really wonderful. The advantages, in addition to reducing the amount of time in treatment, is they're more comfortable, they have lower profile, they never stain, which some of the clear braces did before, and as you mentioned, the most important factor is that they reduce the treatment time, the amount of time that they're going to be in braces.
Yeah, and Josh, how long have you had these on?
Almost a year.
Almost a year, and how's it going so far?
It's pretty good.
Pretty good, yeah. Do you like being in Dr. Haas's office, or is it kind of good that maybe you're not there as much?
Yeah.
Which one?
Yeah, the latter.
He's being nice either way, right?
And these are shots of Josh's teeth before he came into you, and sorry, buddy, that you needed some work, and you're getting it.
Yeah, I don't know if we have the after picture. Well, these are the current pictures, so we're not completely done, but you can see, I think he's in braces for about a year, and you can see the teeth are looking really wonderful at this time. We're almost about a month away from getting his braces off.
And the difference between Josh and Claudia is, a lot less metal.
That's right.
A lot less visible.
Correct. That's the only difference. This is just more aesthetic, or so kind of older patients, maybe older teenagers or adults like to wear those. And as you can see, Claudia's teeth were also a little bit, malaligned, and the teeth are. And how long have you been in treatment, Claudia?
About 6 months.
Okay. And these are the current pictures of Claudia, and you can see that I would say they're about 80–90% straight.
Wow.
In 6 months.
In 6 months. That is incredible.
Incredible, yeah.
All right. And if people want more information, really easy to get a hold of you. 619-DENTIST. 619-DENTIST. You have a couple offices right in Chula Vista, or they could just log on to your website, thesuperdentist.com. And you take really good care of kids. If you need to get a hold of a great orthodontist,
that's right.
This is your man, Dr.
Kids of all ages.
All right. Better San Diego continues right after this. Stay with us.
Thank you.